And is there much kickback from, like, say, you as a medical doctor, like understanding an appreciation of the importance of gratitude and kind of almost like kind of not a spiritual practice, but it's the ultimate acceptance and celebration of what's happening now.
But you can't even put it, the way, like, food has become part of medicine now. As you said, there's lifestyle medicine being taught at Imperial College. Like mindset, you said mindset is part of lifestyle medicine. And I guess gratitude has to be part of mindset because ultimately, most of us are hardwired in our society to think that money, fame, these are the things that are going to make you happy. Then you're successful. You've got status. Wow. Then you're definitely be happy. But ultimately, I think mindset and this idea of this gratitude, being able to cultivate an inner space which is at peace and at ease, irrelevant to what's going on, like that is real success from my definition of it. And I wonder how far we are away from.
I mean, I speaking personally, like I want to be able to be in an uncomfortable situation, whether it be, I don't know, being stuck in an airport lounge for 4 or 5 hours and still have an amazing time. Do you know what I mean? And it doesn't necessarily me being an extrovert and high-fiving everyone and all the rest of it. Just me in my own mind, even if I'm quiet, to be absolutely at peace,
content
in an uncomfortable scenario, or whether it's pain or wherever it might be. That's where I want to get to. And I think we're always striving towards that, right? And I think to bring it back to medicine, there is a much greater appreciation for self-care, and it's being reflected in the types of courses that are being offered, the types of conversations that are happening, particularly post-pandemic, where a lot more people are checking in with each other and actually understanding the impact of the job on our mental health. I think the junior doctor strikes right now is a recognition not just about the physical conditions, not just about the financial hardships, but also about the need to recognize the mental resilience and actually look after that. I'm a firm believer that we should go to a 3 to 4 day work week. I think it's unnatural to work ourselves 5 to 6 days a week, 11, 12 hours a day.
But then I would say that, the way redefining that word of work, like if you look at the root of the word work in certain cultures, it is not that kind of typical association now, which is hardship and grind. And like work, in some cultures, it is an aspect of creativity and there's an expressive aspect to it. So I think that can be part of the story as well.
I think that can
and most of us, a lot of us aren't in that privileged situation. It is a real privilege to be able to.
Totally. And I think we're probably both in that privileged position right now where, I'm on my sabbatical from medicine, as I have been for the last year. Work for me feels like play, right? Like, I record a podcast, I do research, I wake up at the time I want to, I take breaks when I want to. I work freaking hard, probably longer hours than I would do in medicine, but it feels like play to me. But I think there are some instances where people perform work like working shifts in a busy hospital where you're constantly attention switching and you're dealing with drug delivery, prescription, patient complaints, admin issues constantly for 12 hours straight. That for me is pretty unsustainable. And I think whilst you can soften it with a grateful approach that improves your resilience in those scenarios, I think it would be inhumane to constantly experience that for 5-6 days a week, as we are currently right now, probably much longer than that. Actually, long days are 7 to 10 days in certain circumstances. So reframing jobs like medicine, where there is a real sort of pull on our attention and pull on our cognitive abilities, is something that I think we need a different sort of working week structure for.
Yeah, I love that. Yes,
except
please.
I look at our work weeks and work is we've consciously had a different way of framing it from the start. We used to always call it playing shop. We were playing shop, so consciously use the word play instead of work. But I look now like we're like farmers, and we are farmers because we do work on a farm and we have
farmers,
a farm. But I just see work as part of my day. It's part of my life. It's not separate to my life. I don't work and then live.
Yeah.
It's just life. Like life is this. It's just part of life. There's things, and you got to figure out how to find joy in the challenges and the understanding and the growth in these various aspects.
Definitely,
to it.
yeah. And actually, it's really interesting. So I was at a conference recently. It was full of, and this is why I feel that there is a greater appreciation for gratitude, and the more subjective elements of well-being. Because there's a whole conference dedicated to self-care, and during these self-care presentations, any consultants, because this is for seniors, it was specifically for seniors, because
So over 60.
no, senior practitioners. So
Okay.
people who are consultants or senior registrars, people who are sort of at the higher tiers of seniority within the hospital. So that ranges from typically 35 upwards. And within this, there were multiple presentations from consultants about their practices. And some of these guys are working in trauma centers. They're working in very high pressured environments, and they're talking about, the time when you go and wash your hands between a patient, just that those micro moments,
20 seconds.
there's 20 seconds where you wash your hands, like that's a moment to be mindful. So they're literally talking about this today. They are appreciating all these different elements. They practice it themselves. They might not talk about it with patients just yet, but they definitely appreciate it for themselves. And I think that's the first step on the journey, because I had to appreciate nutrition and meditation and mindset and all that kind of stuff myself, and practice it myself and overcome my own issues before I even talked about it with patients. I don't think it always needs to be like that. And I don't think everyone has to go on their health journey to be able to talk to patients about it. But certainly, whilst it's not part of the core medical curricula across the country or across the world, these are things that can push us forward.